The Rafaelo procedure is a newer procedure designed to treat hemorrhoids. It uses a very fine little metal probe that goes directly into the hemorrhoid and uses radio frequency energy to effectively heat up the hemorrhoid and cause it to shrink by fibrosis. The benefits of the procedure are several. The most important benefit is that it's a very quick procedure, and as a result of it not involving any cutting of the hemorrhoids like a traditional hemorrhoidectomy, then you tend to get a lot less discomfort after surgery. So it's, in most cases, it's a relatively pain-free procedure. And in some cases, you can even do it without a general anesthetic, just with some sedation and a bit of local anesthetic. So the recovery is very quick. The post-operative discomfort is very small, and the effects are immediate because of the shrinkage effect of the procedure on the hemorrhoid. And then there's an added benefit that with time, the effect gets even better, because as the fibrosis begins to develop over a period of weeks and months, the hemorrhoids will get smaller still. So overall, it's a better procedure than the traditional hemorrhoidectomy. So there are some risks, as there are with any operation. All operations do carry some minor risks, and the ones specific to the Rafaelo procedure are, as with any operation on a vascular structure, which the hemorrhoid is, then there can be some bleeding after surgery. A lot of that is mitigated against, though, by the fact that the hemorrhoid is heated up and effectively coagulated at the same time as the surgery. Some people do find that they get a degree of discomfort after surgery, again, because of the heating process that happens, and it can be a little bit close to some of the nerve areas around the edge of the back passage. So some people will get some discomfort after surgery. The only other risk is that the Rafaelo procedure is designed for hemorrhoids up to a certain size. If your hemorrhoids are absolutely enormous and you've got lots of external components, what we call skin tags, then it's not necessarily the best procedure for those. And you may be better off with a more traditional procedure to remove those at the same time. So immediately after the procedure, depends on how you have it done, whether it's under a general anaesthetic or under sedation. If you're having it done under sedation, the sedation wears off very quickly indeed, within half an hour to an hour, and then you can usually go about your normal activities. However, as with any form of sedation, you shouldn't be driving for at least 24 hours. A general anaesthetic tends to take a little bit longer to wear off, but again, within a couple of hours, you're normally able to resume most of your normal activities apart from driving. As I said before, some people will get some discomfort, and often that's a feeling as if there's something in the back passage that you need to pass, but that feeling will tend to disappear after a few hours or a couple of days at the most. You should be able to have your bowels open in a normal way. You might be a little bit nervous about the first time that happens, but it certainly won't be any more uncomfortable than having your bowels open when your hemorrhoids were larger in the first place. There isn't any specific post-operative things that you need to take care of. There's no diet that you need to follow. You don't really need to worry too much about having your bowels open, but it is recommended that you don't spend a long time on the toilet sitting there and straining, but that's general advice for hemorrhoids as well. So the Rafaelo procedure is, in my experience, certainly very successful. I've had some very good results with the procedure for the patients. The vast majority of them are relatively pain-free within 24 hours, and every one of them so far I've treated has been pleased with the result and that they've had it done. The one thing that is important to realise that currently the Rafaelo procedure is not fully recognised by NICE, mainly because it's a brand new procedure. So it has partial recognition, so the procedure is acceptable to be done, but the results need to be audited, so everybody will be followed up to check on their progress after surgery. Overall, it works extremely well for hemorrhoids that bleed, and hemorrhoids that are uncomfortable, and hemorrhoids that prolapse. But it's not, as I've already mentioned, the right procedure if you've got very, very large external components.